Hi, Mrs. Scott. I'm Dr. Stephanie Smith. I'm one of the internal medicine residents. I was asked to come down here by the internal medicine team because you were having some nose bleeding that wasn't really well controlled, and we were wanting to come assess you. Do you mind if I just ask who's with you today?
Sure, this is my daughter Melanie.
Okay, hi Melanie. Thanks for being here. So I know that you had a pretty bad nosebleed when you came in, and they did some blood work with you, and they found that you had really low platelets, and those are things that help your blood clot. And then because it sounds like you've been having these nosebleeds for a few days, you've lost quite a lot of bit of blood, and your red blood cells, or your blood, has gone lower as well. So we're thinking that we should probably admit you and kind of explore a little bit more about what's going on and what's caused this.
Okay, how long am I going to be here?
Well, unfortunately, I don't know exactly how long it'll be. We do want to run a couple other tests to see, because we're wondering if maybe you have a condition that where your body kind of attacks your platelets. It's called ITP, immune thrombocytopenic purpura, and it can cause you to have some bruises on your body and sometimes cause you to have those bleeds. But we'd like to monitor for you for at least a couple of days and see how you're doing in hospital.
Okay.
Okay.
Yeah. What are these tests all about?
So some of them are just looking further to see what your blood looks like when we check it again tomorrow and see if there's any change. And then we have to decide if we need to do treatment. Okay?
Okay.
I know you've also had a cough and haven't been feeling great lately, so I'm sorry, but we'll have to do another COVID swab. I know you've had
Oh God, not another one.
Yeah, I know they're not
I've
super
had about
fun.
3 already.
Yeah, I know they're not fun. I've had some myself, but we'll do it as quickly as possible.
Okay.
We just need to make sure that's okay. And I guess the other thing we have to do every time we admit a patient, we need to have a conversation about goals of care and kind of what you would want done if you needed to be resuscitated in the hospital.
What, I'm going to die?
No, I don't mean to say that, Mrs. Scott, at all. I just mean that if something were to happen to you in the middle of the night, we need to know that you want us to do all things to help you, or maybe not everything.
Oh, okay.
So we would need to talk about if you would want, CPR or a breathing tube if things didn't go well throughout the night type thing.
Yeah, I think I would.
Okay, I think that's good if that fits
I'm
with...
not that old.
That's right. So, okay, so if that fits well for you, then what we do is we break it down into different ways here in Alberta, and we say that there's resuscitation, medical, or comfort. Resuscitation, if we put you as an R1, that means you'll get everything done if anything happens.
Okay, I'll take that.
Okay, so we'll write that down. Sorry that I had to have that conversation now in the middle of the night, but I appreciate that.
Yeah.
Do you have any questions about anything, Melanie?
What if she's positive or COVID positive? Can
Well,
I still see her?
So unfortunately, actually, we're not able to have any visitors on the floor right now just because we have a COVID outbreak. We do our best to keep all of our patients safe, but unfortunately that means we can't have visitors. And I know you guys have traveled pretty far, like over an hour and a half to come to the hospital, and that's hard, but we will do our best at keeping you updated by giving you phone calls.
Okay.
Yeah, you can go home, honey. It's okay. I'll be fine. Thank you, doctor.
You're welcome. We'll see you later.
Okay.